Well, BC Seniors Advocate has released a new report. From Shortfall to Crisis is the title of the report, and it looks at the high demand and low availability of long term care beds in this province. And that can mean, of course, long wait times. It also means stress on family caregivers who are waiting for a spot for their loved ones. Well, joining us now with more is Wendy Johnstone. She is the Director of Programs and Innovation with Family Caregivers of BC. Good morning to you, Wendy.
Good morning, Stephen. Thank you for having me today.
Thank you for being with us. When you look at this report overall, what's the biggest takeaway for you?
Well, the biggest takeaway is that while individuals are waiting for long term care, their caregivers are supporting them, holding up the healthcare system at expense of their own well being. That's really what strikes me. And so while we're hoping for system reform, we're hoping for more long term care beds. Caregivers can't wait for that. They need the support now while they're waiting.
And typically, I understand. I mean, there's no one case or one situation, but typically, what does a situation look like where where a caregiver is doing that, is basically filling in the gaps in the medical system?
Yeah, and thank you for recognizing that. We have a saying that when you meet one caregiver, you meet one caregiver. And
Exactly.
right, it's a very complicated, complex, it's very different for every person. But when we see or hear from caregivers who are waiting for long-term care for their loved one, what we're hearing is often a system that just can't meet their needs. So, for example, it's very difficult to schedule care when you're caring for someone who's living with dementia. You're caring with someone with a chronic illness. You're up at 2 a.m. You're up at 5 a.m. and our system's not designed to provide that type of responsive care for caregivers. And so what we find is that caregivers are often caregiving alone. They're often well not supported. They're having to draw on their own financial resources.
Yeah.
They're often having to really look to anywhere to fill the gaps. And then as a result, often what we can see is that a caregiver becomes very ill, often too ill to continue caring, which is what we want to avoid.
Right. And the report also says that there are fewer long term care beds per capita now than there were 10 years ago. How can that be? How are we seeing these numbers shrink when we know the demand is increasing?
Yeah, I think Dan Levitt spoke a little bit about this, around, we've seen this coming. We've seen the, tsunami of baby boomers and
Yes.
what's emerging. So we're seeing a system that, hasn't necessarily put in the resources, over a certain period of time. When I first became a gerontologist, we were in a system where there was a lot of focus on seniors housing, and then shifts. Government shift away from that. But what we're seeing right now is the real impact of just not having put in that time and energy and resources into seniors housing and long-term care. I'd still argue, though, that it's not just about long-term care. It's about how do we support family caregivers who are doing 80% of the care? How do we support them in community while they're waiting for long-term care and while they're still caring for the person in long-term care? They still end up shouldering, taking on 70 to 80% of the care.
And so then the question is, how do you support them?
Yeah, well, I mean, there's outside of outside of learning how to navigate that healthcare system and having a really strong voice as a caregiver. Which, of course, when we're caring for aging parents, or when we have seniors caring for a spouse, those can be tricky. And so, if there's one message for anyone who's caring for anybody, but especially for those waiting for long-term care, we have a free BC wide toll free number that people can call to receive caregiver support. They can receive emotional support. They can receive tips on how to navigate the healthcare system. Our team works at a policy, provincial level to try and increase the voice of family caregivers. But yeah, go ahead.
No, what if they need a day off?
Yeah, what if they need a day off? Yeah, so respite right now in British Columbia is a bit of a tricky one. It can be hard to access. There's not enough, respites bed. But we also say that respite, it's not just about a bed. It's just not about coming in and having someone for 4 hours. It's about trying to find ways and programs and services that can give short, frequent breaks for
Yeah.
family caregivers, because that's what helps them sustain. And currently, we just don't have enough of that. And so, trying to invest a bit more in some of those community-based supports for family caregivers that are a little more responsive,
Right.
that are less rigid and less inflexible.
The report also recommends updates to the current long term care bed expansion plan
Mhm.
to increase capacity of long term care. What would you like to see change to meet that goal? Because as we just said, I mean, the number of beds is actually shrinking against the demand.
Yeah, I think that again, I'm super thankful. We're super thankful for the Office of Seniors Advocate and the voice and the report that they're bringing forward. And so, I think the more we can bring caregivers to the table, the more we can have organizations like Family Caregivers of B.C. at the table around decision making conversations at that policy government level, to really take a look at those conversations. I mean, outright, besides just putting more funding and resources into long term care, that's the most obvious solution. But we need to actually hear from caregivers. We need to hear from the people who are providing 80% of the care. We need to hear from healthcare providers who are also holding up the system to the best of their ability, at that policy and government level.
Hmm. You come by this firsthand because you yourself have been a family caregiver, and
Mhm.
when your organization gets calls for support, most often, what are people asking for?
Yeah. So when people call our line, they're often at the end of the line, and they're breaking. And so the first thing that our caregiver support staff do, our whole team does, is we listen. We listen, we recognize where they're at. And then when they're ready, sometimes people call and they just need that.
Hmm.
And then we move into how can we help them practically? What are there small little things that they can do to navigate the healthcare system? Can they connect with other people in their community that are going through the same thing? Are there local support groups? We have free coaching for people, where they get a certain number of sessions, with someone very knowledgeable that can really dedicate some time to them.
Yeah.
But we really listen to them. We really help them, try and work with what they can do, because sometimes it's really frustrating and really hard when our community doesn't have the resources. And so we can't just say, oh, call here, do
Right.
this, call that. We really have to think outside the box and meet the caregiver where they're at, and what's attainable for them within their current situation.
Wendy, it's so good to hear you this morning. Thank you very much for keeping us on this story, and we'll continue to follow it. Thank you.
Thank you very much, Stephen.
All right, you take care. That's
Bye bye.
Wendy Johnstone, the Director of Programs and Innovation with the Family Caregivers of BC.